Now let's see the bones of the facial skeleton. We have the paired bones and the unpaired bones. Now in the paired bones, we have the maxilla, the zygomatic bone, the nasal, the lacrimal, the palatine, and the inferior nasal concha. And the unpaired bone, we have the mandible and the vomer. Now let's look at the maxilla. Now the maxilla consists of the body and its four projection. We have the frontal process, the zygomatic process, the palatine process, the alveolar process. The body of the maxilla is the largest part of the bone and it is shaped like a pyramid. Now the frontal process has a vertical ridge which constitutes the medial border of the orbit. That is, it has the anterior lacrimal crest. Posteriorly, it forms a lacrimal groove together with the lacrimal bone. Now we can see the infraorbital margin, which has the infraorbital foramen, which is located underneath the orbital ridge and serves as a pathway for the infraorbital nerves and the vessels. Now the zygomatic process of the maxilla grows laterally and meets the zygomatic bone. The other landmarks we see is the nasal crest. Then you can see the nasal notch. Then we have the palatine process, which is the horizontal extension on the medial side of the bone, constituting the roof of the mouth and the floor of the nasal cavity. Now, together with the palatine bone, it forms the hard palate. Anteriorly, it features a small process, and that is called as the anterior nasal spine. Then we can see is the alveolar process, which is an inferior extension of the maxilla. Rather than the porous structure, it forms a maxillary dental arch containing 8 cavities where the upper teeth are held. Then you can see is the maxillary sinus, which is the largest of all the paranasal sinus. Now coming to the nasal bone. The nasal bone are two small midfacial bones of the skull which build the bridge of the nose. It has a superior border, a medial border, an inferior border and a lateral border. Now the superior borders and the main bodies form the bridge of the nose, while the inferior borders connect with the nasal cartilage to form the superior margin of the nasal aperture. Now let's see the zygomatic bone. The zygomatic bone has three surfaces. It has a lateral surface, the posterior medial surface and the orbital surface. Now the frontal process originates from the upper margin of the zygomatic bone. The frontal process features a bony tubercle on its orbital surface called as the Whitnall's tubercle. Now this serves as an attachment site for the lateral palpebral ligament, suspensory ligament of the eye and the aponeurosis of the levator palpebral superioris muscle. Now the orbital surface is smooth and concave. It faces towards the orbit and forms the anterior lateral part of its floor and the anterior part of its lateral wall. It features the zygomatico-orbital foramen. The zygomatico-orbital foramen is a gateway to the bony canal found within the zygomatic bone. Now this canal branches into the zygomatico-facial and the zygomatico-temporal canals. So which is an opening on the corresponding surface of the zygomatic bone. Now the former transmits the zygomatico-facial nerve and vessels, while the latter is traversed by the zygomatico-temporal nerve and vessels. The zygomatico-facial foramen transmits the zygomatico-facial nerve, artery and vein within the orbit and the face. The lateral surface serves as an attachment area of the zygomaticus major muscle on its anterior half and the zygomaticus minor muscle on its posterior half. The temporal process originates from the lower half of the zygomatic bone. And then we have is the marginal tubercle. Now coming to the next bone is the mandible. The mandible is a singular bone that has a distinctive horseshoe shape and it is symmetrical on both the sides. Now the condylar process is a bony extrusion behind the coronoid process which forms the lower bony component of the temporomandibular joint. Then we have the coronoid process, which is the foremost structure of the head of the ramus attached to the temporalis muscle, which is utilized during mastication. Then we can see is the lingula. We have the mandibular foramen, which is the medial side of the ramus, which contains the mandible foramen and which encapsulates the inferior alveolar nerve and its branches. Then you can see is the mylohyoid foramen. Then we have the alveolar process, which is the most important part of the bone in its entirety since it holds the teeth via joint mechanism known as the gomphosis. Then you can see is the mental protuberance. You have the mental foramen, which houses the mental nerve and its corresponding vessels. Next is the body of the mandible. Then you have the ramus. And then you have the mandibular notch. Now let's see the palatine bone. It is a paired bone located between the maxilla and the pterygoid process of the sphenoid bone. Now let's look at the landmarks. It has the incisive canal, it has the incisive foramen, it has a greater palatine foramen, and you can see is the lesser palatine foramen. That is the palatine process. Next, we shall see the lacrimal bone. The lacrimal bone is a paired facial bone that makes up most of the anterior part of the medial wall of the orbit. It is the size and the shape of a fingernail, and thus it is the smallest bone of the skull. Now let's see the inferior nasal concha, which is a scroll-shaped paired bone that rests at the lateral wall of the nasal cavity. It helps to filter and humidify the air that we breathe. Now the nasal concha are also called turbinates. It has the frontal process of the maxilla anteriorly, the uncinate process of the ethmoid bone and the lacrimal bone anteromedially, and the perpendicular plate of the palatine bone posteriormedially. Next we shall see is the vomer. Now the vomer is a singular bone that runs vertically within the nasal cavity, separating the left and the right sides. Now the vomer articulates with the palatine bone, the maxilla, the ethmoid and the sphenoid bone. Now let's look at the landmarks around the vomer. We have the palatine process, that is the alveolar process. Then we have the horizontal plates, and that thin bone that you can see separating is the vomer.